Then I'll just tell people until we start. Hello, we're just waiting on a couple more attendees. Until then, we'll just mute the stream. If they do not show up, we'll continue on with the presentation. Richard or Evan can open the meeting officially. It is 10:38.
Evan, are we ready?
Yep.
Well, let's open the meeting, the special meeting at 10:38 on Monday.
Okay, the meeting will consist of a presentation by Sam Mazza from City Gate Burke about the final status recovery and community risk assessment. Sam, I will share the presentation and then you should be good to go.
Very good, thank you. Perfect. Well, good morning, Snohomish County Fire District number 4 and interested audience. My name is Sam Mazza. I'm a senior fire and emergency services specialist with Citygate Associates, and I'm happy to be here today to present a briefing on our final community risk assessment standards of cover analysis. Next slide, please. We like to start these presentations out with a reminder to our audience that there are no federal or state regulations directing any specific level of fire service in any community. That's a local policy choice, and communities purchase the level of service that they can afford. Next slide, please. When we talk about fire service deployment, we can summarize it in 2 words: speed and weight of response. When we talk about speed of response, we're referring to the single neighborhood-based units deployed across a jurisdiction to arrive at emergencies within a time interval to facilitate or allow desired outcomes. When we talk about weight of response, we're talking about multiple units being able to amass at an emergency incident quickly enough with sufficient number of personnel to prevent the incident from becoming more serious or escalating. Next slide, please. So when we talk about speed and weight of response, we start by reverse engineering the deployment model from what are the service level expectations of the community being served. And typical outcome expectations are survivability from potentially fatal medical emergencies, such as cardiac arrest, stroke, or severe trauma, and as well as containing fires in occupied buildings to the room or rooms of origin. Also preventing outdoor fires from spreading to buildings and wildland areas and becoming more serious fires, and then also providing an equitable level of service as available and ability to do so to all similar risk population and density neighborhoods. We start with a community risk assessment, and here we start by identifying and quantifying the values to be protected within the service area. For Snohomish County Fire District 4, that includes a service area of including approximately nearly 30,000 residents, a little over 11,000 residential housing units, more than 1,000 businesses, and 31 critical facilities, as well as numerous cultural, economic, historic, and natural resources to protect. Next slide, please. For this risk assessment, we evaluated 5 hazards, as you see here on this slide, related to services provided by the district. We don't make an attempt to validate or duplicate the natural hazards typically included in a local hazard mitigation plan, although we do reference a lot of the information from those plans. Next slide. Our risk assessment resulted in these ratings for these 5 hazards across your 3 stations. For building fire, it's a moderate risk across all 3 station areas, moderate wildland vegetation risk in Station 42 area versus the urban areas in Station 41 and 43 in the city of Snohomish. Your medical emergency risk is high, primarily due to frequency of occurrence, and your hazardous materials risk is low, and your technical rescue risk is moderate across all 3 station response areas. And again, this is a combination of frequency of occurrence and predicted or probable impact severity from a hazard occurrence. Next, we look at response performance and compare it not only to current district policy, but best practices as well. And there are essentially 3 components to incident response. The first is call processing and dispatch. That's done by Snohomish 911 Center. Best practice there is 1 minute 30 seconds, and 90th percentile performance for that over the 3 years of the study was 3 minutes and 40 seconds. So you see over there on the right of that, there is no current district policy for call processing dispatch performance, but compared to the 1 minute 30 second best practice, it's 144% slower. So pretty significantly slower than accepted best practice. The second element of response performance is crew turnout. And this is the time from receipt of the dispatch, crew donning their personal protective equipment, and boarding and seat belting into the response apparatus. Best practice for this is 2 minutes. District policy for fire and EMS incidents is 2 minutes 45 seconds. Current 90th percentile performance is 2 minutes 47 seconds. So you see that essentially that's meeting district policy, but about 39% slower than best practice of 2 minutes. And the third element of response performance is travel time. This is actual travel time of the apparatus from the start of movement at the fire station or wherever it begins its response to the incident until it arrives. And there are two separate standards here. In urban areas, we look at a 4-minute best practice travel time 90% of the time. And in rural areas, we typically look at 8-minute travel time 90% of the time. You see over there in the shaded area, 90th percentile performance inside the city of Snohomish is currently 6 minutes 14 seconds for the 3 years that we studied, and 11.5 minutes in the rural areas of the district. And you see the shaded areas to the right there, the green indicating best service or meeting best practice or district policy, and then yellow to orange to red indicating increasing divergence from those standards. Then below first due travel, you see what is labeled as ERF travel. This is the weight of response and effective response force, or first alarm. This is 4 engines or 3 engines in a truck, 1 medic unit, and 1 chief officer. District policy is 17 minutes, 15 seconds, regardless of whether it's in the city of Snohomish or not. Best practice is 8 minutes in urban areas, 60 minutes in rural areas, and you see the current 90th percentile performance in the shaded area at 11 minutes, 25. Although there's only 5 incidents recorded over the 3 years we studied, and all 5 of those occurred inside the city of Snohomish. And then below that, you see dispatch to first unit arrival. This is a combination of crew turnout and travel time. And then below that, you see call to first unit arrival. This includes all 3 response components, including dispatch, crew turnout, and travel. Let's go to the next slide, please. So considering the outcome goals we talked about earlier of keeping building fires contained to the room of origin and preventing death or permanent impairment from a medical emergency where possible, this map shows that even with automatic mutual aid, only 36% of the district's total road miles can be expected to be reached in 4 minutes travel time. These are the green segments that you see illustrated on this map. And that includes, as you can see, most of the city of Snohomish. So again, this is what we would look for in urban areas, urban population density areas like the city of Snohomish. We'd be looking at a best practice of 4 minutes first unit travel time. Next slide, please. Here we see that if we look at 4-minute travel time for station 41 and 43, but 8-minute travel time for station 42 because it's in the more rural area of the district, that improves overall travel time coverage to 57% of the whole district. So a significant improvement there over what we were looking at earlier. Next slide, please. This slide shows that 86% of the district's road miles can be reached within 8 minutes travel time of a first alarm or ERF multiple unit response, again, including 4 engines or 3 engines and 1 ladder truck, 1 medic unit, and 1 chief officer. And again, this only occurred 5 times over the 3-year study period. So good coverage throughout the district for your full first alarm assignment. You're hitting about 86% of the district there with that first alarm assignment. Next slide, please. Again, that was 8 minutes. So now if we extend that ERF travel time to 11.5 minutes, you can see here that travel time coverage is essentially 100% of the district. So the difference between 8 minutes travel time and 11.5 minutes, you can expect at 11.5 minutes that first alarm unit, first alarm response of 4 engines or 3 engines in a truck, 1 medic unit, and 1 chief officer should be able to arrive just about anywhere within your service area. Next slide, please. And this table summarizes all of that. You see on the top line there, 4-minute first due without auto aid, only able to hit 34.6% of the district's total road miles, 286 total road miles. If we include automatic aid, it improves slightly to 36%. If we differentiate 4-minute travel time for stations 41 and 43 and 8 minutes for station 42, that improves to 57%. And then when we look at effective response force or the multiple unit responses at 8 minutes, you're at 86%. If we extend that to 11.5 minutes, now you're at over 99%, or essentially nearly all of your district. Next slide, please. Following that performance analysis, we looked at an alternate deployment model, combining stations 41 and 43 into a single station near the center of Snohomish, which resulted in actually a 6.6% less road mile 4-minute and 8-minute coverage than the current 3-station model. And very little change in the 8-minute and the 11.5 minute ERF travel time coverage. That was reduced only by about 1%. So the alternate deployment scenario again, the 4-minute, 8-minute first due, you're currently 3 stations, you're at 57%. If we combine station 41 and 43 into a single station, that goes down 6.6% to 50.71%. And your current 11.5 minute ERF response coverage is 99.15%. And if we were to combine those 2 stations, that would be reduced by not quite 1%. Next slide, please. In summary, our assessment finds that your annual service demand has been steady over the last 3 years. Your EMS call is increasing slightly, and it consumes about 65% of total service demand. 50% of your call volume is inside the city of Snohomish, probably no surprise, and 14% of your service demand is outside the district. As we said, call processing performance and crew turnout are slightly, well, call processing performance is very sluggish. Crew turnout performance is slightly sluggish, but nearly meeting district policy. Next slide, please. We also find that at least 2 simultaneous incidents are occurring 31% of the time, but 3 or more simultaneous incidents only occur about 6% of the time. And that simultaneous incident activity has been steady over the 3-year study period and is primarily impacting the 2 stations in the city of Snohomish. Your station utilization hour, utilization, which essentially tells you how much percentage of each hour of each day over the 3-year period you have an active incident working at each station, is below our 30% recommended saturation level. You're well below that, so no concern there in terms of saturation for service demand at any one of your stations. Next slide, please. Here again, first due travel performance in Snohomish is a bit sluggish, 56% slower than the 4-minute best practice goal, and also 47% slower than current district policy. And then in the rural areas of the district, it's also about 45% slower than the 8-minute best practice goal for rural areas. ERF travel performance is also slower than best practice in the city of Snohomish. And again, no effective response force incidents occurred outside of the city of Snohomish over the 3-year study period. Dispatch to first unit arrival, again, this includes crew turnout and travel only, is also slower than best practice goals in both the city and rural areas of the district. And dispatch to ERF arrival performance, which includes, again, crew turnout and travel only, is also slower than best practice in Snohomish, but 34% faster than the 20-minute current district policy. Our deployment findings find that the district's physical response resources, your stations and your apparatus, are appropriate to protect the values at risk within your service area. Your current daily staffing level of 10 personnel is minimally adequate for one moderate complexity multiple unit incident response. Again, concurrent calls occur about 31% of the time, and one moderate complexity call for service will likely deplete all on-duty resources plus automatic aid. Your population is projected to increase approximately 10% over the next 14 years to 2035, or less than 1% annually, which will impact service demand slightly. And again, that's going to be predominantly EMS related. Again, current fire station distribution, your current 3-station model, provides 35% coverage of the district road miles in 4 minutes. That goes up 1% to 36% with automatic aid. And 8-minute first due travel covers 81% of the district's road miles. That goes up to 89% with automatic aid. That's distribution. Now, if we look at concentration, multiple unit responses from 2 or more stations, 8-minute ERF travel coverage is 86% of the district, and 11.5 minutes is 99% of the district. We have found that your current 3-station model provides 4-minute and 8-minute first unit travel time coverage to the highest population areas of your district. Our deployment recommendations include amending the current deployment policy to have first due dispatch to arrival occur within 6 minutes for the city of Snohomish response zones at 90% reliability, which includes 2 minutes crew turnout and 4 minutes travel. And for first due dispatch to arrival within 10 minutes in the rural areas of the district. Again, this is 2 minutes crew turnout and 8 minutes travel time. For ERF, we recommend dispatch to arrival be within 10 minutes inside city of Snohomish. Again, 2 minutes crew turnout, 8 minutes travel time. And for the rural areas of the district, we recommend that be amended to 18 minutes to allow 2 minutes crew turnout and 16 minutes travel time. Next slide. We also recommend that the district work to reduce call processing and crew turnout times to more closely align with best practice goals by identifying what is causing that sluggish performance and looking for opportunities to resolve those factors that are affecting that. Also to consider, as funding is available, adding additional daily staffing to improve first due, multiple unit effective response force, and simultaneous incident capacity. And we also recommend that the district maintain its current 3-station deployment model. Next, we conducted an assessment of the district's physical facilities, the 3 fire stations, and find that these were originally designed for a volunteer staffing model and were not intended to accommodate full-time live-in staffing. Also, the 2-story designs tend to hinder rapid crew turnout performance, and most of your facilities do not meet many current health and safety standards, including seismic safety, Americans with Disabilities Act access at stations 41 and 42, a fire sprinkler system at station 43, carcinogen contamination control zones, separate outdoor or outside the living area storage for personal protective equipment, dedicated medical waste disposal, and updated station alerting systems. Some of the operational deficiencies we identified include insufficient functional space in all three facilities, and that varies again by station. No capacity currently for any additional specialized apparatus such as a ladder truck or a boat. We found Station 40 to be poorly located to serve the core populated areas of the district. However, the other stations are generally well located to meet our station siting guidelines, which include serving the most population in the shortest travel time possible, providing a 360-degree service area within the desired first due travel time goal, avoiding political or human-built barriers within that first due travel time goal, and then providing immediate or rapid access to the primary response routes in all directions. So we found essentially that your three station locations meet those pretty well. Our facility assessment recommendations include, as funding allows, to replace or relocate station facilities to meet current health and safety standards and anticipated future operational and space needs in the following order: Station 41 first, followed by Station 42, and then Station 43, again, as funding permits. Recommended next steps include reviewing and absorbing the content, findings, and recommendations of this report, adopting the recommended response performance goals, and again, working with Snohomish 911 to reduce call processing time. Over the longer term, we suggest monitoring response performance and unit workload at least annually, and adding daily staffing as funding allows to improve first due ERF and simultaneous incident capacity. And also, as funding allows, to consider modifying, replacing, or relocating fire station facilities, again, beginning with Station 41. That concludes my presentation. I'll be happy to answer any questions.
I don't have any questions. It seemed pretty straightforward, and just probably going back over it and looking at the numbers a little bit more in depth would probably be helpful. But other than that, it wasn't anything that was shocking.
Okay. Good.
I was wondering when you were looking at the times for responses, that was assuming that we were in the district, right? We weren't coming in from somewhere else.
That's correct. So we only looked at responses inside the district boundary, and when we evaluate incident response performance, we only look at fire and EMS responses, the most emergent incidents. We don't look at the more customer service related service calls, smoke alarms, things like that. We only look at fire and EMS responses. So those are, again, the highest priority incidents that we evaluate.
I was wondering if you also did any research on how many districts from outside our area came in to provide service when we didn't have enough folks in our district.
We did, and that was provided in our incident analysis report that the chief has, and he can provide that information for you. I don't have that readily available in front of me, but it is identified in that statistical summary which departments, which other jurisdictions provided aid.
And for the response times, if the first unit or all the units on scene to a call that was in our district came from outside, that went into that number of the response time numbers that they calculated.
That's correct.
So if Station 83 was the first one to get to an emergency call, that was the unit that got based on that call for first due unit. Our auto aid is built into those numbers you see.
I'm going to go jump in.
That is correct.
You gotta go over there, dude.
I accidentally hit mute on him, now I can't unmute him. Hey, Evan, I accidentally muted you and now I can't unmute you, so you need to talk. There you go. Thank you, sorry.
Sorry, no, I have you muted. This, I got a little munchkin right here that,
Oh, that wasn't me, good.
Yeah.
Gotcha.
no, I'm muting, unmuting as needed.
Gotcha.
So you don't, I'm not interrupting the meeting.
No. And then on the October 25th meeting, I'll take some of the stuff that went through here and go in a little more in depth and we could talk about our response guidelines, how we want to go as a board at that meeting.
That'd be great. All right, so I guess the takeaway would be the biggest recommendation that you can make is getting to the rigs faster to affect the response time.
Well, that's part of it. I think our recommendation also is to work with Snohomish 911 to reduce call processing time to more closely align with that, what is now 60-second best practice, but we're still recommending 1.5 minutes as our best practice. Over all of our client agencies, that seems to be a more realistic goal than 60 seconds. And then to get crew turnout time down closer to that 2-minute goal. So that gives you a little more leeway. You can't make up for slow call processing and slow crew turnout with the accelerator. Just doesn't work. So the way all of those work independently, but you add them up, that's your customer service measure, is from the time 911 answers the call until that first unit arrives at the scene of an emergency.
Yeah.
And we're working with Snow 911. We changed to rapid dispatch in 2019. And then when COVID started, they dropped all the rapid dispatch because of the protocol 36 with COVID. We had about 6 to 9 months of data for the rapid dispatch, and it knocked about 25 seconds off the call process time.
And that's that's obviously county-wide. Obviously, this information is not specific to us, right? There's
no.
Correct. In the county, each agency can choose rapid dispatch or not. And so I doubt the other agencies are much different than us. Those on rapid dispatch are probably in general about 25 seconds faster than all those not on rapid dispatch. And then we're working on other things, but rapid dispatch is back in. It'll take us a couple of years of that to really see how much that affects us, and then we'll continue to work with Snow 911 to make other adjustments to get that.
Copy. Thank you. Awesome. Thank you. Hey.
And well, like I said, we'll go over all that more in depth on the 25th. I'll send you out the presentation. You have the report. As you guys think of questions, just email it to me, and then we can kind of start going over that more in depth on the 25th. And just, however long it takes us to get to the point you want to be, we'll just continue to work through that.
Awesome. That sounds fantastic.
And Chief, if any other questions come up that you need me to respond to, I'll be happy to do that. Just shoot me an email.
Awesome. Thank you. Okay.
You want me to close the meeting?
No, yeah, somebody asked you, yeah.
All right. I'll go ahead and close this special meeting at 11:10.
Thank you, everyone.
Yep.
Thank you.
Thank you.
Guys, have a good day.